Our next speaker is a dear friend that I met on an island, actually. And on an island in Greece, usually you think you're going to be relaxing and chilling and having frivolous conversation. And I met Halland, and we started chatting, and I think after about 5-10 minutes, we're like, wow. The possibilities and the learning, and I think we created a good friendship. Dr. Halland Chen is founder of Cell Theory Labs. He's also the managing director. He is a physician. He's a longevity expert, and he blends regenerative medicine, functional therapies, and biotech innovation. And he does all that to extend, as you were saying, lifespan, optimize performance, treat injuries, and cutting-edge science. He's really focused on university-based research and bringing new IP to market. Halland, please join us on stage.
Thank you, Tassos.
The floor is yours.
Thank you. Thank you so much for having me, everyone. And I prepared 44 slides, so I'll try to make it less. But a lot of it's very visual. So a little bit about what I do. I'm a doctor. I still practice medicine. Just about a third of my time, I actually went into interventional pain management, but I have a tech background, ended up doing a software company, got incubated by GE. So that explains why I went into more of the research side of things. We have a lot of topics that we're going to cover, but I'm going to go through it pretty quickly because the other 2/3 of my time are based on research and stem cell therapy, and then also bringing new IP to market. So what we do is we essentially help young PhD work go to market. So kind of essentially finding the best of the best and validating it. So what are stem cells? It's such a hot topic with longevity being so forefront now these days. Stem cells are basically the basic healing block of your body. And so you're basically harnessing the power of regenerative medicine to heal your body. The problem is it's so confusing on what stem cells are because all stem cells are not created equal. We're going to cover that pretty in depth because you might have a stem cell that's a donor, or you may have a stem cell that's your own. So that's problem number one. And so we're going to get into the cell type, the quantity, and repeatability. The first thing that we really want to talk about is cell type. Because when people talk about stem cells, they actually don't realize there are many different types of stem cells. But the most important ones that we want to do are the mesenchymal stem cells. These are multipotent stem cells. That means it can turn to a lot of different things to help heal your body. So these multipotent stem cells can be good for brain conditions, your body organs, soft tissue regeneration, joints. I worked a lot with athletes, so that's kind of one of the reasons why I got into it. So I've been in the stem cell world for the last 15 years, essentially helping people heal from injuries, because a lot of athletes don't want to get surgeries. The big thing about stem cells is that not only are they self-regenerating, they're going into your body and healing, they're multipotent, they can turn to other cells, and they also affect the immune system. So with a lot of the work that I'm doing now, we have to do FDA clinical trials because we are cloning your cells. When you clone your cells, basically the FDA regulates that as a drug. So we're considered drug manufacturers, and that's why this is under IND. So when you think about stem cells, these are all the functions that they can do. They're multipotent, they can turn into different cells, they can prevent cell death, they're angiogenic, make new blood supply, they're antibacterial, and the last line says they're immunogenic. And so the immune system is a very big problem, is what I'm seeing nowadays. This is why we're seeing a lot of cancers coming into play. A lot of young people are getting cancers. People have abnormalities with autoimmune. So our 4 indications when we actually are doing stem cell therapies cover this, and I'll cover that in a later slide. And the biggest thing that we're going to get into, I'll show you a slide that's pretty interesting with the animation. The hard part about stem cells is doing the tissue culturing. So when you actually are cloning stem cells, you have all these things that are what we call barriers to entry. It's time consuming, it's expensive. A lot of the cells are dead. So even though you're thinking you're getting 20 million, 40 million cells, a lot of them are not alive. And I'll have some slides on that. And then very common questions, can stem cell cause cancer? Typically, if it's embryonic, we don't use embryonic. That's pretty old technology. And then likewise, are the cells unstable? And so this is kind of like telling the slide what used to happen, right? So what used to happen in culturing techniques is most people just culture cells. And I guess the best example is most restaurants are restaurants, but some restaurants are Michelin star restaurants, and there's a difference, right? It's the ingredients, it's a technique. That's very much the IP in the stem cell world. It's how do you cultivate that? So this is pretty much the most important slide you'll see. When we cultivate stem cells, the one on the right is basically a traditional cloning technique. And so when you compare it time to time, we're actually able to clone at 21x more cells. And so what that means is that these cells are smaller and they're less sticky. And so when a lot of people say stem cells don't work, they get trapped in the lungs, that's because when you look at the slide on the right, they're very long and sticky. So they don't make it past the lung into the brain. When you know how to clone cells and feed them properly, they become small, robust. And so it's a 21x more dose. And why does that matter? Well, when you're typically doing a dose, right, some places will do 20 million cells, 40 million cells. We're doing 250 million cells. So essentially, I'm cloning your whole immune system outside your body and putting it back into your body. So classically, I always am patient number one. I've done about 1 billion stem cells in 2025 in my own body. I travel pretty heavily, and so I'm always measuring things on what I'm recovering. And so this is pretty much showing the differences between a normal, like your traditional lab technique on the left, and what we do on the right. And this is just 32 million cells at 5 days. And so we have algorithms to basically predict how do we know your stem cell is actually the correct stem cell. And that's based on morphology, the shape, how fast can we grow it, the differentiation capacity, so if you wanted to turn it into brain tissue, cartilage, help heal autoimmune conditions, identity, purity, genetic testing, and viability. So these are a lot of the things that you're not going to get. This basically talks about like the challenges of cells. So what happens is when we're able to clone the cells, we can clone them out through multi-generation. So when you see P1, 2, 3, 4, that stands for passage. Typically, the biggest problem in stem cells is that people are making a copy of a copy of a copy of a copy. That's where you're going to have your issues. So we take only things up to P4 for treatments, but we've actually multiplied it up to the 12th copy, if you want to refer it to like that, and it's literally exactly the same cell. So that's kind of like a large part of like solving these problems. The other question I get is that I'm older, and older has a different definition these days because, I think I'm older, but, it depends. So they're saying, well, why would I want an older stem cell? So one of the key things that we do is autologous. That means your own DNA. I'm a very big fan of your own DNA being back into your own body. And the reason why is when you're cloning at that high level of stem cell, you don't want foreign DNA. You can get a graft versus host disease. You can get an allergic reaction. And so when we infuse at 250 million stem cells versus getting 20 to 40 million at, like, let's say a center in Mexico or, wherever, all the other places, you're going to have a problem if you do it multiple times. Versus you getting your own DNA multiple times. I've done my own DNA 4 times last year. I don't have any problems. In fact, it's boosting my immune system. So then people say, well, I'm older, I'm 80. What about getting a 20-year-old stem cell? Well, that's actually a great question because when we clone out the cells, it's harder to tell because this is what looks under a slide. There is absolutely no different than a 20-year-old cell and an 80-year-old cell. And the reason why is we're making a drug product. So the FDA says, independent of who the individual is, the age, and all the characteristics, you have to have a consistent end product because that would be the difference of taking one antibiotic and a different antibiotic and they don't have the same effect. So in the stem cell world, to actually get FDA approved, you have to have the same stem cell after the culturing and cloning process. So we basically prove this out that it is indeed the same cell, whether you're younger or older. Because of the way most of the IP is done, we can actually predict how many cells we can grow in 30 days. That's pretty much how we came up with part of the number is 30 days is what we call clone cycle, and that gives you your 250 million cells. And that's what's considered a therapeutic dose in IV. When you do it into a joint, you do about 100 million cells. These slides I'll blast through them very quickly. Differentiation capacity means it actually has the ability to turn into other tissue. So we can actually show that when we differentiate these cells, they can actually turn into tissue that you want. We identify the cells. So there's a lot of science that goes into making sure your cells are high quality. That's kind of why when people say, I'm going to go overseas or somewhere and they're going to inject me with cells, you actually don't even really know what you're getting injected with. And we even do chromosome analysis. Are the cells stable? A lot of people say, well, if you're cloning the cells that many times, will I have genetic abnormalities and get cancer? This is why we do chromosome analysis, and we don't see that, even up to passage 8. So even if we make the copies of a copy beyond what most people do, passage 4, we'll go up to even passage 8 and show that there's no genetic abnormalities. Some of the other things, this is just about viability tests. We are giving you live cells. And so a large part that's very confusing in the stem cell world is that most stem cells are given to you cryopreserved. So they'll pull out the stem cells, it's a frozen sample, and they'll tell you there's 20 million, 40 million cells in there. They're actually half dead sometimes. Whereas we take a culture, we pull your culture from a stem cell bank, everything you get is your DNA and it's fully live. And so that's basically the new era, which is why it's called a banking your youth. All I have to do is take a small fat sample. Fat actually holds stem cells, mesenchymal cells, because stem cells like to hang out in an area that's safe and protected. Your fat has mesenchymal cells, will select out the best cells and bank them. And then these fresh live cells pretty much have about a 97% viability. So not only do we cultivate at 250 million cells, we have 97% of them are alive, versus a cryobank might only have 20 million cells, of which half of them are dead, which gives you 10 million, and basically you can understand why it doesn't work for everyone. So the process when we do banking, this is what I call your insurance plan. You're taking a small extract of fat, we isolate only the best MSCs, we seed it, and create your master bank. This master bank has about 200 years worth of cells. It's about equivalent to 1,037 doses. So, I don't plan to live that long, but if anyone wanted to live that long, you can rest assured that there's enough stem cells for your body to tap into. And so that's kind of where a large part of the science is going into now. What can you treat? Things like chronic pain, autoimmune. Autoimmune is one of the conditions we're applying for with FDA. We also are doing neurodegenerative, which is basically Alzheimer's, dementia, Parkinson's. Orthopedics, that's my area of specialty. I've been doing knee injections and all orthopedic spine stuff for the last 15 years. We have several trials in the expanded access area, phase 1, phase 2 trials as well. And basically, these are kind of the categories we're going into the stem cell world. As mentioned, on autoimmune is quite interesting. I have some rheumatoid arthritis stuff. I think orthopedics is one of the easiest ones to treat just because you're isolating it into a joint. But long hauler COVID is also something that we've been tackling as well, because a lot of people have not only just long hauler syndrome, they have other neurological conditions as well. There's some stuff in the oncology world which I can't cover, but this is one of our rheumatoid arthritis studies in phase 2 right now. We had one injection and already had a 92% reduction in symptoms, and that was over the course of 1 year. From there, you're basically showing, this is just more like study graphs, but if anyone wants to reach me, I have the last slide that covers a lot of the research we do, and basically some of the key results of why this is so effective. These are 15 different subjects, and what this slide is representing is that the cell count is consistent, the actual quality of the cells is consistent, so no matter the actual person, we were actually able to show that we can create a one-to-one sample copy, and it doesn't matter the source of stem cell, independent of age, subject, other conditions as well. And so now we're doing stuff in the TBI space, and my area is obviously longevity. I'm very into biomarkers and tracking. I think longevity is just an extension of basically where we are in chronic illness. So I would say if you want to connect, you can scan the code. There's a form. You can let me know the area of research that you're interested in. And a good deal of what I focus on now is we're pretty much incubating new IP. And so we have a partnership with the university, and my focus now is helping those either PhD people bring that product to market. We'll be launching a venture studio to help fund things at that setting and then branch it out from the university. So we help bring really great products to market and essentially incubate IP and really collect data. And so that's why I've kind of bridged that world between being in clinical medicine and on the research side, but really my passion is helping new technology go to market because of my medical background, and then obviously traveling a lot. So that's kind of the big amount in the stem cell world. There's a lot that we didn't cover, but essentially I would say the key take home points are autologous, you want your own DNA because that you can create a master bank and you cannot have an allergic reaction to yourself. 2, you can get the highest doses of stem cells possible, which is 250 million. 3, being that it's your own DNA, you won't have allergic reactions like other things that you could do in a stem cell basis. And then 4, the areas that we're treating are basically neurological, long hauler COVID, autoimmune, and then orthopedics. So that's most of my research, and then I also do NED work, so we're in the cellular medicine side of things too. So thank you very much. I think I finished somehow early, so if there's 2 minutes, if anyone wants to ask a question, yes.
Skip very fast, right? But obviously on the right-hand side, you had something about pancreatic cancer.
Yeah. The cancer stuff I don't talk on record. That's off-record stuff, but there's some interesting stuff in the heat shock world. So it's heat shock proteins. Heat shock proteins are generated when your body is under intense heat, but there's actually 2 minutes. Yep, 1 minute left to actually. And then essentially from there, You basically, everything's about the body's immune system. So when people think about stem cells, they think it's just about healing tissue. Your own body's stem cell with your own body's DNA is highly immunopotent. So on the cancer side of things, outside of stem cells, there's a thing called heat shock proteins, and that organizes your body's like chaperones and basically things that can attack cancer cells. So that's a whole other topic that's not covered in this, but yes.
Have you seen results on MS?
MS is interesting. That's a different technology. I think stem cells could help because it's a neurological condition. But in the heat shock domain, there's a thing called cold shock proteins. So that's also that too. So everything's really going biological. I mean, people know about peptides. We're getting into what we call regenerative medicine, which is biological medicine. And so now that's why I did more of a university-based project, because you have to incubate those at a university level with PhD talent, but then obviously bring it into a venture studio model where you can fund it privately and not get held up by the university red tape. So.
Can you talk price and cost?
Price and cost, it's hard. That's it's really more IRB research. So as long as it covers the cost of the materials, that's what the cost is. But I'll give you a context. It's probably like 1/20th the cost of what you're seeing in the market, because at that quantity, it'd be pretty expensive. So we're pretty much doing it at the research rate. Thank you so much, everybody.
Guys, just to let you know, Dr. Halland will be with us for drinks, so you can get to ask more questions. We'll do one quick picture.
Thank you. Oh.